So,
hello. It looks like we're starting a couple minutes early.
okay.
We're pleased to have our Aetna team and sponsors here. Presenters, why don't we go ahead and make sure you're muted if you're not speaking.
There's Simone.
Hi, Sally, I made it. I had horrible technical difficulty. I'm so sorry, guys, but I made it. Thank you so much.
Technology is fun.
Yeah.
Hello, everybody. My name is Vincent Tovar, Associate Executive Director of MASBA, the Mexican American School Boards Association. This year, we're celebrating our Golden Jubilee, 50 years of closing gaps in our Texas public schools. Thank you all for joining us as we present Putting It All Together, COVID-19 Healthcare in Schools and Beyond. It's my pleasure to introduce an all-star team of special guests. That's right, an all-star team of special guests. We have Heidi Schaefer. Heidi Schaefer is the Senior Business Consultant for Aetna's Public and Labor Center of Excellence. Heidi served as a Shelby County Commission Chair in Tennessee's largest county, while simultaneously working full-time as Chief Marketing Officer for a medical practice and Chief Operating Officer for a startup aesthetic practice. Simone Gardner is the Head of Community Activation for the Texas, Oklahoma, and New Mexico markets for Aetna. In her role, she is responsible for leveraging resources to create local experiences that build trust with our members, customers, brokers, and communities. Mary Ann Perez is a licensed clinical social worker with almost 20 years of experience in the employee assistance program industry. Mary Ann joined Resources for Living in 2001 as the clinician and elder care information and referral specialist. Sally Imig is market head of sales and service for the public and labor segment at Aetna, where she leads a dedicated team of sales and account team professionals who sell and service all public and labor customers in Texas, Oklahoma, and New Mexico. Stacy Restucci, RN, is the health solution lead across the public and labor segment with a national focus. Stacy is responsible for helping customers and prospects understand Aetna's well-being portfolio and creating population health strategies. And Alan K. Horn is Vice President of Government Affairs at CVS Health. Mr. Horn joined CVS Health in 2003 and currently leads a team that oversees lobbying and advocacy activities in 13 states and Puerto Rico. That's right, an all-star team of presenters today. Thank you so much and welcome, Team Aetna.
Thank you, Vincent. And good afternoon, MASBA members. We are excited to be with you for a few minutes. And you're probably enjoying your sandwich, your glass of water or tea or soda if you have that. And thanks for sharing your lunchtime with us. And we hope we've put together some information for you guys that we hope is helpful to you. Things that we've been working on as a company. And honestly, it's probably not much different than things you've been thinking about. But with the focus on, of course, your members and what you guys are doing. So we got connected to MASBA maybe as much as 2 years ago. We met Jamie Mathias and his staff, and we're just super impressed by you guys' mission and what you're doing to close the gaps. And we fell in love with that mission, right? In terms of closing the gaps and lifting up Latinx students and really lifting up the next generation of leaders, which is so critical in this time that we're in right now. So kudos to you guys. We've been to one of your conferences. It was fantastic. It was in San Antonio. 50 years, my gosh, that's a long time your organization's been around. So we hope to be a part of it for many years to come and support the great work that you guys are doing. So you've met the team, and we're going to spend some time just kind of going through a few things with it and hopping around to some different topics because there's just a lot on everybody's mind today. So again, we'll allow some time for Q&A at the end. But to start with, see if I can navigate this right, and you can see my screen. So putting it all together. So just a quick update too, and many of you guys may know this, but we are now part of the CVS Health family. So CVS purchased Aetna in January of 2019. So we're now 300 employees strong. We're a very big company, but we have a lot of things that we can do because of our size. And honestly, we deal with a lot of the same stuff you're dealing with, like, you know, when do we bring employees back to work? How are we going to do screening and testing? You know, the lower income employees that work with us, how are we going to help them with making sure they get their medications and they stay compliant and they get the behavioral health services they need, and even help with maybe rent and food if they had a spouse that lost their position. So we're doing a lot of the same things you are in this very interesting time that we're in. So we're going to start with testing. So testing is on everybody's mind, and it's like different things that you're reading about, a lot of different things and how it's all coming together. And so Alan Horn, who, as you heard, is our State Government Affairs, VP of State Government Affairs, is really tied into this and very knowledgeable on where we're at today, and I think can share some great information with you. So Alan, Alan's not on camera. He's calling in, I believe, but Alan, can I turn it over to you?
Thank you very much, Sally, and thanks to all for joining today. I'm happy to share and honored really to share CVS Health's testing initiatives that we rolled out some weeks ago. Some of you may have seen on the news about a month and a half ago, we started with basically 5 mega sites in Georgia and Massachusetts, Rhode Island, Connecticut, and Michigan. And these were very large sites, not at our CVS pharmacies, but in parking lots that were large enough to accommodate a significant number of people on a daily basis coming through to be tested. We were using the Abbott rapid testing machines at those sites. And to date, we've tested almost 200,000 people in our mega sites. Building upon our mega sites, about 4 to 5 weeks ago, we rolled out our ambitious plan of 1,000 testing sites across the United States. These would be testing sites at our CVS pharmacies. A person would go online to cvs.com, would make an appointment, would drive through at their appointment time, drive through the pharmacy. They would receive a swab, a Q-tip for illustration, and they would self-swab, hand that back to the technician or pharmacist there at CVS. CVS then sends that off to the lab, and then the lab handles all the reporting. To date, we have tested almost 200,000 people in our CVS pharmacy sites. That includes 20,000 people here in my home state of Texas, across 86 sites. Additionally, next week we'll be rolling out a few more sites, which will give us more than 90 sites across the state of Texas. Additionally, in Texas, we have opened 2 community sites, one in Houston and one in Fort Worth, working with our community partners, where we will be able to really get into the communities, both through our CVS pharmacies and our partnership with our community partners. We expect this testing to continue through the summer, and then, you know, who knows what the fall might bring, but we have certainly learned a lot over the past 3 or 4 months regarding testing, and I'm happy to say we are a company that was able to respond to the need that was there regarding testing across the country. Sally, that's kind of a brief overview of where we are today.
Okay, thank you very much. And I will say that, you can go to cvs.com, because I did it myself. So I am about to go enjoy the birth of a granddaughter in the next few days in Los Angeles. And so I'm looking at, should I be tested, right? These are just normal questions people ask, right? Should I be tested? So our company has testing sites, as Alan said, all around. So I went to cvs.com, and it's very obvious. It says interested in COVID testing, and you click on it, and then up pops a series of questions. They follow the CDC guidelines. And the first question it asks you is, do you have a doctor's order? Well, I didn't. And then it asks you other questions like, are you a healthcare worker, or obviously police, fire, ambulance person will know. Do you have these chronic conditions? And I didn't have any of that. So there's a series of questions you answered. Bottom line is, I didn't meet any of them. So that says, and it makes sense, right? So the testing is still somewhat limited. We don't have enough testing equipment and all of that for everybody to just walk in and get a test. You have to meet certain CDC criteria. But it's very interesting. You can just go do it yourself. Just go to cvs.com if you're interested, right? And that's how the public can go get tested. So when Alan was speaking to that, as they're opening up these 1,000 sites around the country and more eventually, then you put your zip code in and it'll direct you to a site if you meet the criteria. They will collect your insurance card, they will bill your insurance, but if you don't have insurance, it's covered. So it shouldn't stop people from getting tested, but there is a whole lot going on in testing. And we're happy to answer questions. We don't have all the answers, nobody does right now, but there is a lot of good information out there. The other thing our company is doing is they realize large employers, and not even necessarily large, but employers are interested in having some help going back to work, right? So how are we going to test people going back to work? So there is a CVS product now called Ready Return. We just learned about it ourselves. It's basically a company can decide to do on-site screening, or they can send people to the local CVS stores, the drive-through process. So more and more coming out on that, but it is a system and a process that's been designed for that. So anyway, at the end we'll have Q&A, but there is a whole lot going on with testing. So thank you, Alan. And literally by the week it's changing. Your best bet, if you're curious, because there are CVS stores everywhere, is just go to cvs.com and it's all posted online there.
Thanks, Sally, and thank you for mentioning the cost. I neglected to mention that, and I think that's key to our testing. There is no cost to the patient. Right.
Yep. It's all covered. So I'm going to spend just a couple minutes with you now on some things that we're doing. And this quote here is I'm sure not news to any of you, but we know this, and it's important as we develop our plans and our products and our services. We know that Hispanics underuse health and mental health services. They're less likely to see a doctor, get the preventive screenings, which is your blood pressure checks, your mammograms, your cervical exams, your prostate exams, your colonoscopies, or be hospitalized. And then of all the Hispanic peoples, Mexicans have the lowest reported use of all, right? So this is also just some good factual information from the Pew organization about the breakdown of the ethnic groups, the 10 largest in the United States, but the chart on the right is just Texas. And so what we also know is that since 2000, the growth of the Hispanic, Latinx origin is 65% growth rate. It's the highest of any. Blacks was 22% and non-Hispanic whites was less than 5%, as I recall. So you are really, really growing. And so why is that important? And then tie that to what we read in that first slide that said less likely to see a doctor, less likely to get preventive. So why is that, right? So is it due to cost? Is it because people are confused? Is it because it's inconvenient? Well, we would maintain it's all of the above, right? So you can see the stats here. I think the second one is of great interest and should be to you too, because you all have health plans at your schools, and 9 out of 10 adults lack the health knowledge and resources to manage their care, which is why they need a primary care physician, why they need to be tied to a clinic that they can trust, why it's important for us to have have Spanish speaking materials for people to make it easy for them. So there's a lot of things that we're trying to solve for and to really help people just live the best they can, the healthiest that they can possibly live. So introducing CVS Health Hubs. You may have not seen these. So to address the inconvenience, well, actually all of them, costly, confusing, and inconvenient, CVS well, now almost going on 2 years, a year and a half ago, said we're going to take our stores that they have 11,000 stores around the country, and we're going to take some of our stores, and we have a concept that we think is going to work. And inside many of these stores, it's what's called a minute clinic, an urgent care center, staffed by professionals, open longer hours than regular doctor's hours, and they're designed to capture those people that have a hard time going to the office Monday through Friday, 8 to 5, because they're working. And so they built these health hubs. And the very top picture, if you see one of these in your community and you see the red doors with the heart, that's a health hub. So if that's a CVS store by you, go walk through that. They're addressing convenience. They're really addressing the confusion. So every one of them has a care concierge, somebody that's in there at the Minute Clinic location that can help the person navigate the healthcare system, talk to them about what are you looking for. They go to the Minute Clinic, get seen if they need to. They walk them right over to the pharmacy if they need their medications, if they need any of their supplies, they're right there and they're out the door. So we've had outstanding feedback on this. And it's lower cost than emergency rooms. It's lower cost than freestanding emergency rooms or freestanding clinics, many of which are out of network, which are very high cost. So I just wanted to show this to you that these are picking up in various markets. So here's a picture of Houston. So if you look at the red hearts, those are all health hubs. So if you are listening and you live in the Houston market, and we'll get you these addresses, we can get that over to Vincent and to Jamie so it can get out to the membership. And we have them all around the state of Texas, so we can send that list to you. But you can see that they're scattered around the city, and there's more to come. And then these are just the health hubs, and there's a whole lot of CVS stores and then Minute Clinics, but we wanted to highlight the health hubs. And then we're expanding further into Texas because we have had, like I said, such great success, and they lower the cost for people, make it convenient, and they help with the whole confusing. But you can see the size of the circle tells you the number of basically CVS stores, Minute Clinics, and health hubs. So obviously Houston would have a large number of them. The whole Dallas-Fort Worth market, a number of them. There's a couple getting ready to open in Austin market. There's obviously CVS stores and Minute Clinics here, but a couple of health hubs, and then also in our San Antonio market. And they've even talked, I've heard, moving into the Valley. So we don't have data on that yet, but I wanted to show you that these will be options for people to more access to care, which is what people need. This slide was of interest. I had not seen this before, but it's just a fantastic picture of a multi-generational family, grandpa, celebrating a birthday, or maybe it's the little boy, I don't know. But if you look to the right, it's very interesting to look at mortality rates per 100,000 and what the conditions are. And so by knowing this, then we also know the programs that we needed to continue to develop as if we have like a primarily Latinx population. If you look down here, chronic liver disease, diabetes, HIV, AIDS, and unintentional injuries is highlighted because they are where the mortality rates are the highest as compared to the whites. But look at the flip. The whites, we're more likely to die of a disease of the heart, a stroke, cancers, all the different types of cancers, COPD, pneumonia conditions. So just, we're all different, right? And so we have to know about all of our different populations. And as I turn it over to Marianne Perez, who's going to talk about the behavioral health, this all comes into play when they work with your employees and your members. And whether you have Aetna or not, your healthcare provider has these services, and working with them to make sure that information gets out to all your people, because there's a lot available. People just don't know how to connect the dots, and that's what we try to do, is help connect the dots. So with that, Mary Ann, can I turn it over to you?
Absolutely. Thank you so much. Thank you again for the opportunity to speak with you today. I am Mary Ann Bettis and the director of our clinical and work-life operations for Aetna's EAP. I do work out of our Austin, Texas office, so I had the pleasure of participating on a panel at the MASBA conference in San Antonio earlier this year. So I'm happy to be with you again today. Looking at this slide, and just in what we're discussing today, I mean, I think it's safe to say COVID has impacted everything around us, everything that we touch, everyone around us. And when schools and businesses started to close in mid-March, we immediately switched gears from business as usual and began pulling together toolkits with resources and information, creating relevant webinars around COVID and its impact, providing on-site response to our customer locations that remained open because not everybody closed. And those customers wanted us there to support their employees that were on site. And of course, we were transitioning our own staff, our own EAP staff from the work site to home. So as we were trying to help everybody else, all of our members. During this time and since COVID began in March, we've received over 13,000 calls at this point related to COVID specifically. And we saw an incredible increase in telemedicine utilization. It's a 5,000% increase. And what that means is our members working with our in-network providers for counseling services, and they're doing that via the telephone, chat, and televideo. To share a little bit about the kinds of calls that we saw starting in March to now, although our overall call volume actually decreased a little bit, the acuity of the calls definitely was higher. Lots of people calling in about food, meals, supplies, and masks, where to get tested. Many calls about unemployment, and I'll talk a little bit more about that later. And then calls regarding relationship issues at home, as you can imagine, because everybody's cooped at home, once those stay-at-home orders began. And then certainly parents and guardians all of a sudden, needing to homeschool and balance that with work, and again, our own employees were dealing with the same thing. We transitioned everyone to home. So they were continuing to do their work, but also had to take, breaks to tend to children or help them with their Zoom class, et cetera. So it was not only impacting those that we were trying to support, but, our staff who were providing the support and were the, first responders, for our organization, most certainly. Locating food and meal assistance has been a difficult task. As you can imagine, many of the standard food and meal programs or pantries closed, in March, and many of them have continued to be closed. Many rural communities, have their churches are the main resource, and many of those, certainly closed, although we're starting to see some of those reopen now, but those were kind of our go-to whenever we would speak to somebody who needed that kind of help. Our process has been, and always has been, to make calls in that person's community to see what might be available from a resource standpoint. Fortunately, as most of you probably know, many schools were offering meals. So that was absolutely one of the resources that we shared with many people calling us. Sally, if you can move to the second slide, or my second slide rather. Want to share some statistics related to the impact of COVID on the Hispanic community. Looking at economic and financial, first of all. The unemployment rate is higher, 18.9%, than the overall unemployment rate. I mentioned earlier that we've received many calls about unemployment, and most of the calls were due to frustration and fear, quite honestly, that the local unemployment office wasn't picking up the phone, Their websites weren't working. As you all can imagine, the websites were on overload from an unemployment application and status standpoint, so that the volume was more than those sites could handle. So people were confused. They were worried about their unemployment application and getting those benefits. And of course, looking for new work or jobs if someone was laid off or furloughed was not an easy process either. So providing a lot of support around those very stressful situations. 70% reported not having emergency funds to cover 3 months of expenses. And honestly, that's not an easy thing for a lot of people to do, but certainly a strong impact on the Hispanic community. And 44% reported that they could only make partial payments towards bills, during this time. From a mental and physical health standpoint, 67.1% of those with a mental health condition do not seek treatment, compared to 56.7% of the general U.S. population. And we know right now there's a lot of stress and anxiety and depression that folks are dealing with. So that makes this number even more impactful. And over 20% say that they are feeling anxious about COVID-19. Nearly 12% have reported gaining weight during the pandemic. And as Sally was mentioning earlier, when we look at health issues, we know that if that is a huge concern for this population due to the number of people with diabetes and high blood pressure and heart disease. So great impact there as well. 1 in 3 Latinas will experience domestic violence in their lifetime. And since sheltering in place orders began in mid-March, alcohol sales, and everybody's probably heard this, already, but alcohol sales, which is a key predictor of domestic violence, has increased 234%. It's a really powerful number. The National Domestic Violence Hotline has reported a significant increase in calls to their hotline during COVID. And keep in mind, in a lot of cases, the abuser has been laid off or unable to leave the house for work. So they're stuck, in that house together. With families and other people impacted as well around the clock. Another, interesting piece of information to go along with that, and I started hearing this on the news, as many of you probably did as well, that police, when COVID began, were actually reporting a decrease in crime reporting. So I found that very interesting. And then to hear, what the National Domestic Violence Hotline was reporting. So that the crime reports going down, but the calls to the National Domestic Violence Hotline significantly going up. Regarding case rate inequities as it relates to COVID, 16.4% of the United States COVID deaths are among the Latinx population. 17.8% are not covered by any form of health insurance at all, and that's in comparison to 5.9% of the white population. And Sally spoke to that earlier as well. One of the things that we were, certainly helping our callers with is locating, where they could go to get tested, considering they didn't have any health insurance coverage. And then on my final slide, I just wanted to end with talking a little bit about the importance of self-care and caring for each other. This is not business as usual, and many of us are more stressed than what we may realize. So, these are just a few ideas about what you can do to help alleviate that stress. And the main takeaways really and truly are working in some physical activity, practicing mindfulness, connecting with your support system, and having a routine. Having a routine is incredibly important, and just doing the things that you would, normally do if you're able to, right? And then being open to new ways of creating that calm and just self-care. utilizing and sharing resources like your EAP, if that's something that you have available to you, your behavioral health benefit, community or national resources like the crisis text line, the National Suicide Hotline, or the National Domestic Violence Hotline as well. So thank you. I look forward to questions at the end.
Okay, I had to take myself off mute. Thanks, Marianne. And
Sure.
yeah, hold on here. Get to the next. Oh, I bet we were supposed to be on that slide. Sorry about that. And now,
It's okay.
Now we'll move to Simone. Simone, are you there?
I am.
All right. Tell me when to move the slides for you, okay?
Okay, you can go ahead and move now quickly, Sally, on that one. That was just the introduction.
Okay.
Yeah, and I just wanted to point out, first of all, thanks so much for allowing this time to speak to you all. It's a pleasure to be here. And we at Aetna, a CVS Health company, as Sally alluded to earlier, that it purchased Aetna in 2019, January 2019. But just wanted to really stress our commitment that we understand that connecting people through community transforms healthcare on the home front. So we understand the importance of going to the grassroots, going into the community and working directly with the homeowners, those who live in these communities where we live, work, and play. It is important to engage them and help them on their pathway to better health. Next slide, please, Sally. Thank you. And I wanted to take a moment to overview. In my days, I worked for a health plan prior to coming here to Aetna, and I serviced Medicaid clients. And in that field, you know, there's a lot of underserved members in the community that we're dealing with day in and day out, and they have real issues, sort of what Marianne spoke of earlier about there being a strong need for food. There's a lot of food insecurity, housing insecurity. There's many things that they must face daily in addition to their health concerns, right? So they're worried about things like food and housing, and then they may have blood pressure, diabetes issues, all those things that because there's so much uncertainty about where they're going to get their next meal or how they're going to pay their rent, how are they going to pay their light bills, that their health goes by the wayside. They become secondary to, you know, our more needs, right? And so in the community, what I learned was 211, which ran by a lot of usually United Way, but in Houston, it's a city operation that runs it. But 211, if you're not familiar with it, it's basically a free call that you can make from your landline or your cell phone, just simply dialing 211, and they will connect you to local resources. It's at no cost. It's available 24 days a week, 24 hours a day, 7 days a week. There's services provided in English, Spanish, and like over 80 different languages. They can help connect you to resources within your local community. And as Marianne spoke about earlier, they're getting calls for food pantries, where to go to these shelters, right? And there was, because of COVID, things shut down very quickly. And so these, you know, organizations and food pantries that were always normally staples in the community, those shut down, and they had to figure out new ways to engage and help the community. Well, 211 did a really good job at keeping up with that. So at a time like now, during COVID and emergency crisis times, they really step up their resources because those organizations reach out to them directly and provide updates about, well, no, we're not meeting on 5th Street anymore because of, you know, XYZ may have happened here, but we've moved. And see, 211 keeps up with all of that. So again, if you're needing assistance with information about transportation, childcare, employment, like for there was services provided where they would help members in the community apply for unemployment benefits. That was not easy for a lot of folk in the community, especially if there are computer challenges, not sure how to work the system, all those things. They could offer up resources within the community that could help them, you know, complete this very much needed application for unemployment. And also they have resources to free healthcare clinics, counseling services, legal assistance. All of these really great things can all be accessed by dialing 211. And also they're available online as well. So if that's not something that you're familiar with, that is a very good resource to kind of add in your pocket, in your toolkit, and how you can help your members, your constituents, and all that you come in contact with on a daily basis. Next slide, please, Sally. And Project Health. This is a really exciting program. I don't know if a lot of folk know about it, but it's something that CVS Health has been committed to for over 13 years. It's local, it's at no cost, and it's available at participating CVS locations. And what Project Health is, it's a free check-in for a checkup. Basically, you can come into CVS to pick up your prescriptions or to pick up other household needs that you need at the store. But also during September and December at participating locations, you can also get free glucose checks, blood pressure checks, information about diabetes, things about smoking cessation programs, all these things that we know in our minority communities that we typically tend to over-index on things with high blood pressure, diabetes issues, things like that. They are able to get in front of, the goal is to get in front of these chronic conditions, to identify them so that they don't become life-threatening illnesses, down the line for our members in the community. This is a great program. It's at no cost. I touched base with the program director before I presented this to make sure that the program is still slated to happen across the country, and it is. So from September to December, we're hoping to have Project Health all over the country, especially in Texas. Texas is a big state, and they offer up literally hundreds of locations. And when we do get those locations, I'll make it a point to share that with Sally and Vincent so that it can be shared out with the other MASBA members. But again, another great program, another way that CVS is committed to at the very local grassroots level in helping our community members on their pathway to better health. That's our goal. We know if they're healthier, then it's a better community for everyone. Thank you. I look forward to questions at the end.
Hey, Simone, I have one question because I think I heard about, remember earlier in the presentation, I talked about the very first slide that talks about, let me get my video going here again. Hold on.
Okay.
There we go.
Okay.
It mentioned that the Latinx are less likely to see a doctor, less likely to do their preventive screenings, and that cost, inconvenience, and just confusion overall, it really impacts all of us, but particularly that Latinx. So I thought I heard, correct me if I'm wrong, that one of the things on Project Health that is so powerful is that they don't keep any record, right?
Oh, no, that's right.
Can you
Yes.
speak to that? Because I think there's a lot of, the people are scared to come in and talk about that a little bit so people can hear that.
Sure, I will. Yeah, great point, Sally. I hate that I omitted that, but yes, this program, it's no cost and there's no record keeping. They don't ask for ID, they don't ask for an insurance card. There's absolutely nothing that you need to provide, right? Outside of you come up and say, hi, I would like to participate in the program today. That is literally it. They mark that it was a female, the race, and so on and so forth, but that is it. There is nothing else that's going to identify that you participated in that program. And that's what makes this program so unique. And I think that's why this program is so successful, is because all of those barriers and all of those things that cause the obstacles that are there that cause certain clients to, be reluctant about coming in, CVS Health has removed that, right? It is, they offer bilingual staff. So it's very comfortable. It's in, secure locations within the store. So you can just, like I said, if you walk into the pharmacist, get your prescription, they're right over there to your right or to your left, right? And you can just simply stop by. No information needed from you at all. The goal is, again, is just to help folk get on their pathway to better health, to identify these chronic conditions that we know a lot of times, unfortunately, in these communities, underserved communities, African-American communities, Hispanic communities, that we have problems with blood pressure and diabetes. And a lot of times we don't find out about them until, we're hospitalized. There's been a stroke, there's been significant incident that has happened. So this is what CVS Health, the Project Health program, is trying to prevent.
Right. Really great service to take advantage of, right? So with that, we are at question and answer time, right? So let me go back up to the top here. And Vincent, can we, or let me just ask, does anybody on the line have any questions about anything that we've talked about today? Anybody learn something new they never heard before? For me, I didn't know about 211 until about 6 months ago.
Great program.
I think there are a ton of questions that we're really trying to think of as far as how do we shift the culture of the Latinx community. I mean, I'm hearing and really appreciate all the data, the research, the ground connection that you all are presenting today. And have you seen or observed shifts in communities, especially Latinx communities, where they're now, you see Latinx folks saying, I'm going to CVS more, I'm going more, I'm trying to get and support my community to be more mindful and intentional into getting checked and making time to take care of myself. Have you noticed that over the course of the last 3 months?
Well, you mean in terms of the start, well, since COVID has started, because that's the last 3 months, I think overall we've seen claims are down, which means people haven't been going to the doctor. This is across the entire population, not just Latinx, but we're starting to see a resurgence of that, and people will start going back. But even before COVID, there's a hesitancy, right? To seek the kind of care, and it's really to know about what's needed. And so the attempt is to make these things simple and easy to access. I know the clinic that Alan talked about, the testing clinic in Houston, it's at the West Chase Medical and Dental Clinic, and it sits right in a very dense Latino or Hispanic population area. The one in Fort Worth is primarily an African American community. So they're trying to pick spots where they can reach different parts of our society and get them the services that they need. I don't know, Simone, is there anything you want to add to that?
Yeah, I'm not aware over, a change per se in the last 3 months, but I can certainly say that the work we're doing now, right, putting these clinics, these COVID testing sites with like Mercy Clinic in Fort Worth and the one you just mentioned here in Houston, we're being very strategic about that so that we can influence their decisions, right, to be more mindful of CVS Health and connect that back to their health because of the things that we're doing in the community with private health. That is the work that's happening so that eventually we will get to that point that we will see more of our Hispanic and African American communities using that as a resource for their health care, before they get into a health crisis, right? We want it to be preventative, we want it to be comfortable, and we want them to be educated before they are, forced into a situation because of a health crisis.
Are there certain services or resources that are dependent upon folks being documented, legal citizens?
No, for Project Health, absolutely not. There's nothing that you need to provide, right? That's what makes the program so great and so unique, is that there's absolutely no documentation needed whatsoever. They're able to access this services, no cost, receive a $5 gift card for services within CVS, all without providing any information.
Right. So if a member goes to the Project Health, when that starts, that's completely free. That's what Simone's talking about. If they go into a Minute Clinic, yeah, there's a charge just like any other urgent care. They can certainly pay cash, or if they have insurance, present that. Those would be the two options there. And then because the pharmacy's right there, there's a lot of help that we can provide if they need pharmacy assistance, so coupons, different things like that, or they'll hook them up. The Health Hub has a part of the Health Hub is where we have other workers, dietitians, other clinicians, social workers to help people. So if you envision going into one of these health hubs, and I mean, we've had stories where they're just first diagnosed with high blood, they don't even know they have it, and they get diagnosed with high blood pressure. They immediately get them on medications. They walk them over to the dietitian. They talk to them about the kind of diet they should be eating, the exercise they should be doing, and then they hook them up with a primary care doctor in the community, or they can use the clinic for a while. They prefer that they hook them up with a primary care doctor, but the bottom line is it's a full service clinic in the CVS stores. So that is where we're headed, to really capture 20% of the population, at least overall, has no primary care physician relationship. That's what we have to change. And so the next visit they do is they end up in the emergency room and it's $1,000 bill. So we want to prevent that from happening. So yeah, there's lots of good stuff. It's connecting the dots, as I mentioned before, for people.
We do have a question from Hayes ISD trustee and immediate past president of MASBA, Willie Tenorio. He asks, how could a school district go about setting up a work program for our teachers and other staff with CVS?
Right. I tell you what, just if Vincent, you can help me connect. So there's literally a CVS sales team that is talking to customers about this, and they will go through the various options and, you know, to see if there's a fit or something, but that's how it works. It's just, I mean, literally it came out last week, the whole new program. So if you can connect me, Vincent, I can get them in touch with the right people. It's called Return Ready. The program's called Return Ready.
Return Ready, absolutely. And there will be an evaluation, brief evaluation at the end of this webinar. So anybody that's watching can reply to it with any questions or any information that they'd like to request from you, and we can connect you accordingly. Yeah, so appreciate you saying that.
All right, and that was somebody from Eanes ISD, you said?
From Hayes?
Oh, Hayes, okay.
Right,
Okay.
yeah, like Utah, just south of Austin, kind of San Marcos area.
Right.
Yeah, between San Antonio.
Okay.
I'm a Jaxie Hayes High School graduate.
Hey,
Right.
there you go.
Yeah, we're all family, and
Yeah.
I think that we're all learning, you know, as far as how to take care of ourselves, and especially, you know, you mentioned alcohol. I think that a lot of times Latinx community doesn't talk about things. You know, they don't talk about problems or struggles that are internal or within family. You know, we tend to hold grudges. We tend to ignore things or wait and postpone and stall. And so I appreciate, you know, you sharing the data and hope that it forces necessary conversations that need to happen and really push our culture to having healthier lifestyles.
Right, right. I mean, you guys are we mentioned the fastest growing part of our population. So we need you all to be healthy. We need you to be our leaders of the future. We need to, you know, what you guys do in your organization is so important. So thank you for focusing on that. And like I said before, we're thrilled to be a part of it and support it. Here to help any way we can, you guys. Just give us a holler.
How do you noticed, or have you noticed what in a lot of Latinx communities we don't call, but in other communities is called anxiety. Anxiety isn't a word that I've ever heard used by Latinx community member, but it's something that we sense and we see with any kind of stress when it comes to you know, family or events or health risks. We see that a lot of times we see our people that are anxious, and a lot of folks we can see cover that with alcohol or with work or with distractions or ignoring it. And so I guess my question is, outside of counseling, which is another thing that, you know, a lot of Latinx community members will say is for people that are crazy, right? When I in my work and in my, you know, personal life, I've told folks that everybody could use a counselor and everybody could use help from an expert and trained and degreed and knows other strategies and ways to get help. But as far as anxiety goes, you know, we don't want to just encourage people to take pills. You know, we want to encourage people to connect with the community and to really be able to be open about it. I'm wondering if you've seen or know of resources for folks that are just beyond stressed and beyond anxious with rent, with paying bills, with food scarcity, with resource scarcity. I haven't used a sanitizing wipe in 2 months, and I consider myself to be privileged. So just all kinds of things going on. What are other resources that you might recommend when it comes to anxiety for anybody in any community?
Marianne?
Well, yes. And you're right. Absolutely. I mean, certainly in the Hispanic community, talking about anything mental health or even saying those words, mental health, is, you know, practically unheard of. So it is very difficult, you know, to know, and that so many of Hispanics are struggling with anxiety or depression and not getting the care that they need. And a lot of times, hopefully they're talking to someone, you know, maybe it is a family member, maybe it is, you know, a friend that they are confiding in. And certainly, you know, if you encounter, you know, that person and you observe and recognize that they are struggling and probably not using the word anxiety. You know, you don't want to say to somebody like, are you, you know, feeling anxious, or do you feel you have a problem with anxiety? Because they'll probably shut down. But it's more about identifying the behavior, like, you know, hey guy, I noticed that you're, you know, drinking a lot more, or drinking every day, or you just seem kind of down, you know, just describing it in a different way versus using the word anxiety or using the word depressed. What is the behavior that you're observing, and letting that person know that you're worried about them? You know, what can I do? Or, hey, you want to talk about it? And if you can engage that person in a conversation, then you can, you know, possibly get to that point of, you know, do you want to talk to somebody? There are different resources out there available. You know, certainly if somebody has insurance coverage or EAP, those are great places to start. 211 that Simone mentioned earlier will provide resources for community, you know, mental health as well. CVS, you know, of course, Minute Clinics too, if somebody wants to go in. I will say, you know, I will share down the road, one of the other things that we're looking at for the clinics is offering coaching in those clinics. It's not available yet, but hopefully we'll be able to talk with you about it at a later time when it is available. But that's also going to be a resource for the community that my team actually will be driving and delivering in terms of how that's going to work. And, you know, engaging, you know, the other family members, the support system of that individual is also really important. You really to just talk about it. One of the things that we tend to do is ignore and not say anything about what you're observing in somebody else. And it only continues to build and get worse. And right now it's so hard because, you know, folks aren't necessarily comfortable doing some of the things that they would normally do to relieve some of that stress. So really talking about it, engaging that person in a conversation, sharing what you're observing and your concern, and then hopefully helping that person utilize some of the resources that they have available to them from a benefit standpoint or just from a community standpoint.
Thank you.
Great question.
Hey, this is Heidi again, and I just wanted to jump in here if y'all don't mind. I just got reminded that, we're offering, Aetna is offering right now free access to our therapists during COVID. And there's no timeline when that will end. So we'd be happy to share that resource with anybody. We've called it liberalizing the benefit, but we have free access to therapists because honestly, the trauma that the kids are going to feel, the teachers from compassion fatigue, you school board members I know have just been wearing yourselves out trying to figure out how are you going to hold class and how are you going to get kids graduated and how in the world are you going to start school up again. It takes a toll, and if you deal with it earlier, the research says that you'll be able to move and grow better. So it's part of CVS Aetna's opportunity to give back. So for anybody who's willing, we've got excellent, they call it EAP, which is just, I can't even remember what it stands for, but that's what we call in when we need a little lift and a boost. And let me tell you, I've done it myself. All the exercise in the world wasn't enough to help get me over being on house arrest for a few weeks. And but it is available to y'all, and we would love to be able to share that benefit with you.
These are great questions. Any others?
We don't have any more other questions submitted, but as I said before, folks can respond to the evaluation they'll receive immediately after we're done here in a couple minutes. And I will speak as well. And I think that a lot of times, I'm glad Heidi said, what she did. I think a lot of times, we hear or we see a list of resources and services and things like that, but we don't oftentimes say that we ourselves are taking advantage of them because, we have our own conflicts, both personal and within our family. I know even just last night, we had to have a sit down with all four of us in our family about my son and his summer camp. His summer camp is so demanding that it's stressing all of us out. And brainstorming and problem solving, and calming, and planning process to really make time on how are we gonna, how are we going to help him, and we thought it was going to be fun, but it's a little more stressful than it is fun. So appreciate, all of you for sharing your resources. Did you have any other last words? That sounds bad for a healthcare webinar, but any closing?
I would just say, it's been tough, right? And I'm a nurse by background, and so I get very passionate about people taking care of themselves and getting the resources that they need. So just take good care of yourselves, get plenty of rest. It's very important to get rest, and wash your hands, do everything. But we're all in this together. There's no magic bullet to anything right now. So just like us, we're in this together. We're thinking of you. Thanks for the opportunity, Vincent and Jamie. Really, really enjoyed visiting with you guys today.
Thank you.
Thank you.
Thank you, Team Aetna, an all-star cast. It's great to be with you and have you today. Thank you, everybody, for watching. We're still going to have webinars on Mondays, and as things happen and issues arise, we'll let you know of future webinars. So stay tuned. But thank you again, Team Aetna, and please feel free to respond to the evaluation, and I'll get those results to you ASAP. Aetna All Stars, and have a great rest of your day, everyone.
Thanks, Vincent.
Bye. Thank you.
Take care. Bye-bye.